Welcome to Wally's Nursing Videos. Today, we're delving into the complex realm of human emotions, particularly focusing on anger, hostility, and aggression. Let's unpack each of these concepts and explore their implications, clinical manifestations, etiology, treatments, and management strategies. Anger, a natural emotion. Anger is a fundamental aspect of the human experience. It arises when individuals feel frustrated, hurt, or fearful. When handled appropriately, anger can serve as a positive force for conflict resolution, problem-solving, and decision-making. Physiologically, it triggers the body's fight-or-flight response, preparing us for self-defense. However, when expressed inappropriately or suppressed, anger can lead to negative outcomes, including physical or emotional health issues and strained relationships. Hostility and aggression, expressions of anger. Hostility, often manifested through verbal aggression, involves behaviors such as verbal abuse, lack of cooperation, or threatening conduct. Aggression, on the other hand, encompasses physical acts such as attacks on others or property destruction. These behaviors may stem from feelings of threat or powerlessness. The phases of anger. Anger, a primal emotion deeply ingrained within the human psyche, often follows a distinctive progression, traversing various phases before reaching its culmination. Understanding these phases is paramount for effectively managing and mitigating the potential consequences of unchecked anger. Let's embark on a detailed exploration of each phase. Phase 1, triggering. The triggering phase marks the genesis of anger, where an individual encounters a stimulus perceived as frustrating, hurtful, or threatening. This trigger could stem from external factors such as a perceived injustice, criticism, or interpersonal conflict, or internal factors like stress, fatigue, or unresolved emotions. During this phase, physiological arousal occurs, accompanied by heightened vigilance and the activation of the body's stress response systems. Emotionally, individuals may experience a surge of irritation, annoyance, or indignation as they confront the perceived source of their distress. Phase 2, escalation. As anger intensifies, it enters the escalation phase, characterized by a rapid amplification of emotional arousal and behavioral manifestations. In this stage, the individual's cognitive appraisal of the situation may become increasingly distorted, with a heightened focus on perceived injustices or provocations. Physiological responses, including increased heart rate, muscle tension, and adrenaline release, further fuel the escalation process. Verbal communication may become more confrontational, assertive, or aggressive as individuals attempt to assert control or express their grievances forcefully. Conflict escalation becomes a distinct possibility as tensions mount and rationality gives way to impulsivity. Phase 3, crisis. The crisis phase represents the apex of anger's progression, where emotional arousal reaches its zenith and self-control becomes increasingly tenuous. In this heightened state of agitation, individuals may exhibit overtly aggressive behaviors, including verbal threats, physical confrontations, or property damage. Rational thought processes are often eclipsed by an overwhelming surge of emotion, leading to impulsive and potentially harmful actions. The risk of violence escalates significantly during this phase, posing a threat to both the individual and those in their vicinity. Without timely intervention, the crisis phase can culminate in irreversible consequences, including physical harm, legal repercussions, or damaged relationships. Phase 4, recovery. Following the peak of emotional intensity, the recovery phase heralds a gradual subsiding of anger's grip as physiological arousal begins to dissipate and cognitive clarity gradually returns. During this period, individuals may experience a sense of emotional exhaustion or remorse as they reflect on their actions and the consequences thereof. The recovery phase offers an opportunity for introspection, reconciliation, and the initiation of conflict resolution efforts. Strategies for self-soothing, relaxation techniques, and constructive coping mechanisms may be employed to facilitate emotional regulation and restore equilibrium. Phase 5, post-crisis. The post-crisis phase represents the aftermath of anger's tumultuous journey, where individuals navigate the aftermath of their emotional outburst and its impact on themselves and others. In this reflective phase, individuals may engage in post hoc rationalization, attempting to justify or contextualize their behavior in light of their emotional state. However, genuine introspection and accountability are essential for growth and learning from the experience. Reconciliation efforts, apologies, and reparative actions may be undertaken to mend fractured relationships and restore trust. Additionally, proactive measures to prevent future anger escalations, such as stress management techniques or communication skills training, can be implemented during this phase. Onset and clinical course. Understanding the clinical course of anger, hostility, and aggression is crucial for effective management. Anger, while often perceived negatively, is a normal emotion that should not be denied or eliminated. However, inappropriate expression can escalate into hostility or aggression. Various therapeutic approaches, including catharsis and cognitive behavioral therapies, can help individuals manage anger more effectively. Additionally, the clinical course of hostility and aggression typically involves distinct phases, including triggering, escalation, crisis, recovery, and post-crisis stages. Related disorders and etiology. Several psychiatric disorders and neurobiological factors contribute to the development of hostility and aggression. These may include paranoid delusions, auditory hallucinations, dementia, head injuries, substance intoxication, personality disorders, depression, and intermittent explosive disorder, IED. Neurobiological theories suggest imbalances in neurotransmitters like serotonin, dopamine, and norepinephrine, as well as structural damage to the brain's limbic system or frontal temporal lobes. Psychosocial factors such as dysfunctional family dynamics, social determinants of health, and interpersonal rejection also play significant roles. Cultural considerations. Cultural values and beliefs influence how individuals express and perceive anger. Cultural differences can lead to disparities in health outcomes, and some cultures may have specific syndromes related to anger suppression or aggressive behavior. Treatments and nursing interventions. Effective treatment of anger, hostility, and aggression involves addressing underlying psychiatric diagnoses and employing pharmacological interventions when necessary. Lithium, carbamazepine, valproate, atypical antipsychotics, benzodiazepines, haloperidol, and lorazepam are among the medications commonly used. In the nursing process, assessment involves identifying factors influencing aggression, evaluating clients' history and beliefs about anger, and assessing behavior to determine the phase of the aggression cycle. Managing aggressive behavior. Nursing interventions focus on early intervention and de-escalation techniques to prevent harm. During the triggering phase, approaches include empathetic communication, encouraging verbal expression, and offering quiet spaces or medications as needed. In the escalation phase, assertive communication, setting boundaries, and providing a calm environment are essential. Crisis management may involve restraint by trained staff, prioritizing safety, and debriefing afterward. Post-crisis, discussions about triggers, feedback on behavior, and reintegrating clients are crucial for recovery. Workplace hostility and community-based care. In healthcare settings, workplace hostility is a significant concern, with overt and passive behaviors contributing to a negative work environment. Standards and protocols for managing disruptive behaviors and promoting professional conduct are essential. In community-based care, effective management of comorbid conditions, regular follow-up, medication compliance, and participation in support programs are key components. Self-awareness. Lastly, self-awareness among healthcare providers is paramount. Nurses must recognize their own management of anger, practice restraint techniques, remain calm and non-judgmental, and learn from experienced colleagues when dealing with hostile or aggressive clients. In summary, understanding and effectively managing anger, hostility, and aggression require a multifaceted approach that considers biological, psychological, social, and cultural factors, along with tailored interventions and ongoing self-reflection among healthcare professionals. As we conclude today's insightful journey into the multifaceted realm of anger, hostility, and aggression, I hope you've gained valuable insights that will empower you in your nursing practice and beyond. Remember, anger is a natural and complex emotion, but understanding its nuances and the phases it traverses can be instrumental in effectively managing and diffusing potentially volatile situations. As caregivers, it's essential to approach each individual with empathy, compassion, and a commitment to promoting healing and harmony. By honing our skills in de-escalation, conflict resolution, and self-awareness, we can create therapeutic environments where patients feel understood, respected, and supported. I encourage you to apply the knowledge and strategies discussed today in your interactions with patients, colleagues, and yourself. Together, let's cultivate environments of safety, understanding, and genuine care, where the transformative power of empathy and compassion can truly flourish. Thank you for joining me on this enlightening journey. Until next time, stay curious, stay compassionate, and continue striving to make a positive difference in the lives of those we serve. This is Wally from Wally's Nursing Videos signing off. Take care and see you in the next video.